The Boys and Girls Clubs of West Phoenix are teaming up with Bayless Integrated Healthcare to staff on-site behavioral health coaches in a program designed to improve the mental health of children who face financial and cultural barriers to healthcare. Dr. Kristen Ray is the Vice President of Wellness for Bayless Integrated Healthcare. Dr. Ray, good to have you here. Thank you so much for joining us on this very interesting deal now regarding the Boys and Girls Clubs of West Phoenix and helping in terms of behavioral health services. Talk to us about this.
Yes, thanks so much for having me. I'm really excited to talk about our program. We ended up getting a grant a couple years ago to start a program. It was a really unique program to pair a club with their own behavioral health provider. And so we call them wellness coaches. Our goal is really to destigmatize therapy, especially for kids, especially for areas that may have some stigma attached to it. And so we call them wellness coaches, and they're social workers or counselors, people that have training in behavioral health services with kids and families. And yeah, they're down there and they really embed themselves into the culture of the club. And so even though they're employees of our agency, Bayless Integrated Healthcare, they really try to become a part of the club. So they get to know all the kids, all the staff, the families, and so that there's a trust that's built there, that they're a team member as well there to help and support.
What kind of interaction are we talking about here, and what kind of services are offered?
Yes, we provide more formal counseling services. So your tip of how you would think of counseling. So we do individual, group, or family, work with parents separately, work with the whole family together, and sometimes we see the kids separately as well. But we also interact with the kids to build that culture like I was talking about. So, some of the counselors will play basketball or play games or go on walks, use the play space, and really get to know what the activities are that the kids enjoy too. So, so that they are able to implement kind of on timing strategies. So if they're having struggles getting along, that they're able to implement those strategies on the basketball court or, in the yard or things like that. So they're able to really help support the kids in their environment.
And you mentioned the cultural link. I kind of want to find out more about this because these sounds like these are kids that are facing either financial or other barriers to treatment.
Absolutely. So, oftentimes, the Boys and Girls Club is a huge part of our community, and they provide a lot of support for working parents and parents who maybe not be able to afford services, after school activities and things like that. And so a lot of our kids go to schools with, where they are provided their meals and things like that. And the Boys and Girls Club really helps to support the continuation of those services. And so a lot of our kids struggle with, having to, walk or take a lot of public transportation to get to services. And so by providing the services where the kids are, really reduces a lot of the barriers that a lot of folks see when they're trying to get their kids care. And so that helps with less transportation, less trying to move between different appointments at different places and things like that. So it really kind of brings all those services together in one place.
Yeah, instead of the kid going to care, the care is going to the kid.
Absolutely. Yes. Yeah.
Yeah. The importance of this support system in general for kids and their mental health in general.
Yeah, so I think what we found, especially right now with, the state of everything, stress is at an all-time high for parents and for kids. I think we have a lot of fatigue with just, in general, just with the way things are going. And so we, our kids want to get back to living their lives, and our parents and their support systems are really struggling. And so, and even, right now too, the support system is really struggling because there's so much additional stress right now. And so really trying to provide both the staff and the kids and their families with that additional support can be so helpful, because we've seen definitely an increase, in depression and anxiety and overall stress. And so it's really important that, everybody has at least one positive, supportive adult in their life that can really, actively listen to them, be there for them without judging, their behavior or the reasons that they're doing things, and really help support them to have more positive interactions with other kids and with their teachers and with their parents and families as well.
Yeah, you mentioned parents and families. Can they take part in some of this counseling and some of these services as well?
We know that our kids do not live on islands. They are part of multiple systems. And so they are part of communities. They're part of, religious groups. They're part of schools. They're part of their families. And so we work with whoever is on that child's team, if you will, to really provide those services. So parents can take part, siblings can take part, any other caregivers that are in that family system. So if it's aunt, uncle, grandparents, a lot of our kids are supported by a lot of different people. And so we want to make sure that we include everybody in those services. So anybody that's in that kids group can really take part.
Okay, and this is the Boys and Girls Clubs of West Phoenix. Any other Boys and Girls Clubs going to take on this?
We hope to eventually get a wellness coach in every Boys and Girls Club, but we are starting off, our next site is in Chandler, so we're working on getting a good fit out there, but we are very much looking forward to this partnership. It's been a great partnership over the years, and Boys and Girls Club has done a lot of great work, and we're very excited to expand the program.
Hey, and last point, before we let you go, the state of mental health services in Arizona, where are we at?
I think we're doing okay, but I think there's always room for improvement. I think, access to care is always so important. And I think we have such a small window, especially for behavioral health and mental health needs. And when people are stressed, we have a very short window to get them into care. And so having enough providers to really see people quickly is really where our improvement, capabilities are. And so I think when somebody asks for help, being able to get them connected to a behavioral health counselor or social worker within, same day or within 24 hours is really our goal. And I think we're getting closer to that, but there's still some barriers that prevent us from doing that. And so I think overall as a state, we need to continue to look at how we provide services and reducing the barriers, with telehealth. Telehealth has been great for this community, and really expanding our ability to cover our kids and families.
Well, this program sounds great. Dr. Kristen Ray, Bayless Integrated Healthcare. Thank you so much for joining us and telling us about it.
Thank you.